Managing migraines can be challenging, but understanding your medication options is a crucial step toward relief. In this video, we'll explore the different types of migraine medications, how they work, when to use them, and what you need to know to find the best treatment for you. Migraine is a primary headache disorder frequently accompanied by symptoms such as nausea, vomiting, and increased sensitivity to light, sound, and smell. Some individuals also experience auras, neurological signs that often precede the headache phase. Approximately 1 in 7 adults in the United States suffer from migraines. In 2016, the economic burden of migraines was estimated at $36 billion, which includes both medical expenses and loss of productivity due to disability. Moreover, there are about 1.2 million emergency department visits annually for migraine treatment, many of which could potentially be avoided. This presentation will review the main classes of migraine treatments currently in use that have strong supporting evidence. Treatment options are generally divided into 2 categories: abortive and preventive therapies. Abortive treatments aim to stop a migraine once it begins and tend to be most effective when taken early in the headache's course and at an adequate dose rather than in smaller, repeated doses. It is important to note that many oral abortive medications may be less effective due to poor absorption caused by migraine-related delayed gastric emptying. Abortive treatments for migraine. Anti-inflammatory medications, NSAIDs and acetaminophen, nonsteroidal anti-inflammatory drugs, NSAIDs, are among the most widely used and well-supported treatments for acute migraine attacks. Common NSAIDs such as ibuprofen, naproxen sodium, aspirin, acetylsalicylic acid, and diclofenac potassium have demonstrated effectiveness in randomized controlled trials and systematic reviews. Other NSAIDs include tolfenamic acid, piroxicam, ketoprofen, and ketorolac. Acetaminophen, as well as combination medications containing acetaminophen, aspirin, and caffeine, have also shown consistent efficacy in relieving migraine symptoms. Mechanism of action. NSAIDs work by inhibiting the production of prostaglandins through reversible inhibition of cyclooxygenase enzymes COX-1 and COX-2. Prostaglandins, particularly prostaglandin E2, are involved in the inflammation and pain associated with migraines. Aspirin differs slightly as it irreversibly inhibits COX-1 and COX-2. The exact mechanism of acetaminophen is not fully understood. It is thought to act centrally by enhancing serotonergic pathways involved in pain inhibition. Acetaminophen may also influence opioid, eicosanoid, and nitric oxide pathways. Adverse effects. NSAIDs commonly cause gastrointestinal side effects such as indigestion, abdominal discomfort, and diarrhea. Less frequently, they may lead to easy bruising, skin reactions, allergic responses, especially in asthmatics, gastritis, esophagitis, gastrointestinal bleeding, kidney impairment, liver dysfunction, and cardiovascular events. Acetaminophen is generally well tolerated when used at recommended doses. However, excessive or prolonged use can cause liver toxicity and, less commonly, kidney damage. Contraindications. NSAIDs should be avoided in individuals with known hypersensitivity to these drugs. They are also contraindicated during the preoperative period of coronary artery bypass graft surgery. Caution is advised in patients with significant cardiovascular disease, kidney problems, gastrointestinal ulcers or bleeding disorders, and those on anticoagulant therapy such as warfarin. Acetaminophen is contraindicated in patients with hypersensitivity to the drug and those with severe active liver disease. Triptans. There are 7 triptans currently approved by the FDA for the acute treatment of migraines. These include sumatriptan, elatriptan, naratriptan, zolmitriptan, rizatriptan, frovatriptan, and almatriptan. Compared to NSAIDs, triptans tend to be significantly more expensive. They are often prescribed when other treatments, such as NSAIDs or acetaminophen, have failed or when the migraine headache is severe. Mechanism of action. Triptans function as serotonin receptor agonists, primarily targeting the 5-HT1B and 5-HT1D receptors, with variable effects on 5-HT1F receptors. Their action involves binding to postsynaptic 5-HT1B receptors located on the smooth muscle cells of blood vessels, causing vasoconstriction. They also bind to presynaptic 5-HT1D receptors on trigeminal nerve terminals and dorsal horn neurons, which helps inhibit the release of inflammatory neuropeptides and reduces pain signaling. Adverse effects. Common side effects associated with triptans include sensations of pressure or tightness in the chest, throat, or jaw, as well as limb heaviness, muscle pain, and fatigue. Less frequent adverse effects may include flushing, tingling sensations, paresthesias, dizziness, weakness, and mental fogginess. Contraindications. Due to their potential to increase blood pressure, triptans should be avoided in patients with uncontrolled hypertension, ischemic heart disease, cerebrovascular disease, or peripheral vascular disease. They should not be used within 24 hours of taking another triptan or ergot-type medication. Triptans are also contraindicated in individuals with hemiplegic or basilar migraine and those with significant liver impairment. Antiemetics. Antiemetics are an important treatment option when migraines are accompanied by nausea and vomiting. They are often used in combination with NSAIDs or triptans but can also be used alone. Two commonly used antiemetics for migraine relief are metoclopramide and prochlorperazine. Among these, metoclopramide has the strongest evidence supporting its effectiveness and is less likely to cause extrapyramidal side effects compared to prochlorperazine. Other antiemetics include domperidone, promethazine, and chlorpromazine. Mechanism of action. Metoclopramide is a benzamide that blocks dopamine D2 receptors at lower doses and serotonin 5-HT3 receptors at higher doses, helping to control nausea. Prochlorperazine and chlorpromazine act primarily as dopamine D2 receptor antagonists, providing both antiemetic effects and migraine relief. Adverse effects. Many antiemetics used for migraine treatment carry a risk of prolonging the QT interval on the ECG, which can lead to a dangerous arrhythmia called torsades de pointes. Metoclopramide, prochlorperazine, and chlorpromazine may also cause extrapyramidal symptoms such as dystonia, tardive dyskinesia, and akathisia. Administering diphenhydramine alongside these medications can help prevent these side effects. Other less common side effects include headaches and allergic reactions, including anaphylaxis. Contraindications. These medications are contraindicated in individuals with known hypersensitivity to the drug or a history of extrapyramidal reactions. Ergotamines. Ergotamines were once a common treatment for migraines but have largely been replaced by triptans due to the superior efficacy of the latter. Among ergotamines, dihydroergotamine has shown some effectiveness, whereas the efficacy of ergotamine itself remains uncertain. One systematic review found that dihydroergotamine was less effective than triptans. However, when combined with an antiemetic, it demonstrated similar effectiveness to other treatments such as ketorolac, opiates, or valproate. Dihydroergotamine may be considered as an option for patients who do not respond to other medications, including triptans. Mechanism of action. Ergotamines, like triptans, are potent agonists of the serotonin 5-HT1B and 5-HT1D receptors. They relieve migraine pain by constricting the intracranial extracerebral blood vessels via the 5-HT1B receptors and by inhibiting trigeminal nerve transmission at both peripheral and central 5-HT1D receptors. Additionally, ergotamines interact with other serotonin, adrenergic, and dopamine receptors, leading to constriction of both peripheral and cranial blood vessels. Adverse effects. The most common side effects of ergotamines include nausea and vomiting, so these medications are typically administered with an antiemetic. Dysphoria linked to central 5-HT1A receptor agonism is another potential side effect. Contraindications. Patients with cardiovascular disease should avoid ergotamines, similar to triptans. The vascular constriction effects of ergotamines are more pronounced than those of triptans because ergotamines also act on adrenergic and 5-HT2A receptors, increasing the risk of peripheral vascular complications. Preventive treatments. Beta blockers. Several beta blockers, including propranolol, timolol, bisoprolol, metoprolol, atenolol, and nadolol, have demonstrated positive results in preventing migraines. However, beta blockers with intrinsic sympathomimetic activity, such as acebutolol, alpranolol, oxprenolol, and pindolol, have not proven effective for migraine prevention. Mechanism of action. The exact mechanism by which beta blockers prevent migraines is not fully understood. One theory suggests that beta-1 receptor blockade may inhibit the release of noradrenaline and the activity of tyrosine hydroxylase, which could contribute to their preventive effects. Additional proposed mechanisms include serotonergic blockade, inhibition of thalamic activity, and blockade of nitric oxide pathways. Adverse effects. Common side effects associated with beta blockers include drowsiness, fatigue, dizziness, and weakness. Other possible adverse effects are weight gain, symptomatic low blood pressure, nausea, vomiting, diarrhea, cold sensations in the hands and feet, dry skin, dry mouth, dry eyes, slow heart rate, bronchospasm, shortness of breath, hair loss, visual disturbances, insomnia, sexual dysfunction, and metabolic changes. Contraindications. Classic contraindications for beta blockers include asthma and chronic obstructive pulmonary disease due to the risk of inducing bronchospasm. Cocaine intoxication is also considered a contraindication because of the potential for coronary vasospasm, although this remains a subject of clinical debate. Antiepileptics. Several antiepileptic drugs, AEDs, have been studied and shown to be effective for migraine prevention, with topiramate and valproate supported by the strongest evidence. Mechanism of action. The precise way antiepileptics prevent migraines is not fully understood. Topiramate acts by blocking multiple channels, including voltage-dependent sodium and calcium channels. It also inhibits glutamate-mediated excitatory neurotransmission, enhances GABA receptor-mediated inhibition, inhibits carbonic anhydrase activity, and reduces the secretion of calcitonin gene-related peptide, CGRP, from trigeminal neurons. Valproate likely works through similar mechanisms, enhancing GABAergic inhibition, blocking excitatory ion channels, and downregulating CGRP expression in brain tissue. Adverse effects. Topiramate's common side effects include nausea, vomiting, diarrhea, drowsiness, dizziness, weight loss, tingling sensations, paresthesias, fatigue, and nasopharyngitis. Less common effects can include rapid breathing, tachypnea, palpitations, bleeding, mood changes, painful urination, dysuria, blood in the urine, hematuria, and increased urination frequency. Valproate's common side effects include nausea, vomiting, diarrhea, abdominal pain, headache, drowsiness, hair loss, tremors, dizziness, visual disturbances, ringing in the ears, tinnitus, appetite changes, and weight gain. Other potential adverse effects are confusion, severe drowsiness, bleeding, and inflammation. Contraindications. Topiramate is contraindicated in individuals with known hypersensitivity to the drug. Valproate should be avoided in patients with hepatic dysfunction, mitochondrial disorders, hypersensitivity to the medication, urea cycle disorders, and pregnancy due to significant risks. Remember, effective migraine management often involves a tailored approach guided by your healthcare provider. If you experience frequent or severe migraines, don't hesitate to discuss medication options and preventive strategies with your doctor. Your path to fewer and less intense migraines starts with informed decisions and the right support.